NCD prevention and control for the working population in Japan. Non-communicable diseases, or NCDs, are defined by the World Health Organization, WHO, as a group of chronic diseases including cancer, diabetes, cerebral cardiovascular disease, respiratory disease, and mental health disorders that are caused by unhealthy diet, lack of exercise, smoking, excessive drinking, and air pollution. Globally, 47 million people die from NCDs annually. Of those, 18 million are under the age of 70. Protecting the working population from the threat of NCDs is not only important for their health, but also for economic development. In Japan, a country with one of the longest life expectancies in the world, extending healthy life expectancy is emphasized in its NCD prevention measures. Healthy life expectancy refers to the years of life that an individual can live without restrictions on their daily life due to health problems. Living an active and fulfilling life requires continuous efforts in NCD prevention from a working age, but this generation tends to deprioritize it because they have no time to reflect on their own health. However, in order to live a long and healthy life, it is vital to raise awareness of one's own health, especially among the working population. To this end, Japan has been addressing NCD prevention nationally since 1978. One of the measures is Health Japan 21, which promotes appropriate and efficient responses to health issues and needs that vary according to region and age group. Since 2024, the third term of Health Japan 21 has been implemented to extend healthy life expectancy and reduce health disparities. Under Health Japan 21, local governments formulate and implement municipal health promotion plans in accordance with the basic policies stipulated under the Health Promotion Act and in line with regional characteristics. They are making a universal approach by linking national policies to local government measures. Furthermore, health checkup results and medical expense data are being utilized for planning and monitoring so that measures are aligned with local conditions and changing needs. This video features the NCD prevention measures for the working population through the initiatives of one municipality in Japan. Oita Prefecture is located in Kyushu in southern Japan. In 2010, out of the 47 prefectures, healthy life expectancy was low, with men ranked 39th and women 34th. NCD prevention measures were particularly urgent since healthcare costs per capita in Oita Prefecture ranked 4th worst, and the mortality rate due to renal failure for the middle-aged was high. Dr. Shuji Tonai is the director of the Hohi Public Health Center, operated by Oita Prefecture.
We found that healthy life expectancy in Oita Prefecture was low for both men and women in 2010. Analysis of the causes revealed a sharp increase in NCDs after the age of 50 in Oita citizens. At the time, we thought that promoting a healthier lifestyle requires the efforts of various organizations in the prefecture, including the business sector, in addition to those of healthcare providers. This resulted in the establishment of the Oita Council for Creation for the longest healthy life expectancy in Japan, made up of top executives from business and other sectors in the prefecture. This council became a major motivating factor towards the goal of extending healthy life expectancy.
Prefecture-wide efforts resulted in a major improvement in Oita Prefecture's healthy life expectancy in 2019. achieving first place in Japan for men and fourth for women. Let's look at initiatives by Takeda City, which boasts one of the best health indices in Oita Prefecture. Takeda City public health nurse, Ms. Miki Kudo, says that the most important aspect of NCD prevention measures for the working population is the population approach.
As NCDs are closely connected to lifestyle habits, a high-risk approach to prevention is important. But we need to work to improve health levels, not only of patients, but also of their families and the overall community.
Takeda City had the largest proportion of people undergoing dialysis in the prefecture. Based on that data, the city decided to implement a project called Campaign for Healthy Blood Vessels, built on the 3 pillars of attending medical checkups, increasing vegetable intake and reducing salt, and improving exercise habits. Ms. Takako Horita, a registered dietitian in Takeda City, says that raising community awareness was truly a grassroots activity.
It is difficult to access fresh food because Takeda City is located in a mountainous area. There was a long tradition of preserving food with salt, and many residents had high blood pressure. So, we held public seminars on nutrition, and as part of that, we had everyone bring their own miso soup from home, measured the salt concentration, and used it as a teaching tool for reducing salt. We have been promoting salt reduction activities step by step in our community.
In these community-based activities with each resident, the Aiku Health Promotion volunteers play an important role. Aiku Health Promotion volunteers take a meticulous approach, encouraging residents to have health checkups and connecting them to hospital visits or municipal health consultations if they notice any health concern. Takeda City public health nurse Ms. Hiroko Kodama says that this approach is highly effective.
Oita Prefecture ranks every municipality based on 13 health indicators. Takeda City usually ranks about first or second every year. The reason for that is the high rate of health checkup. Another feature of Takeda City is the high level of participation in community seminars and events. I think that the reminders for health checkups by Aiku Health Promotion volunteers also has an impact.
Hohi Public Health Center leverages interpersonal connections, also known as social capital, to engage with the local community. As the shape of the family changes in modern Japan, this initiative aims to re-emphasize the importance of human relationships. By fostering networks between the healthcare providers and local residents, all stakeholders gain a shared understanding of the initiative's purpose. This leads to a sense of looking after one's own health, and then to a healthy behavior change. Oita Prefecture and Takeda City are also taking a proactive population approach to the working population in business sectors. This is Takayama Gumi Company Limited, a construction company in Takeda City. It has fewer than 50 employees. Across nearly 100 years since it was founded in 1928, it has engaged in public works in Oita Prefecture. The Director for General Affairs, Ms. Satomi Takayama, says that employee health promotion is essential in the construction industry.
Our company exists because of its employees. The President's motto is Health for All Employees, and we have encouraged all employees to undergo health checkups for many years. For our female employees, we ensure that they are screened for cancer specific to women such as cervical and breast cancer.
Takayama Gumi has a health checkup rate of 100%. As a result of proactive health promotion initiatives, the company has been certified by Oita Prefecture as a business with excellent kenko, good health investment for health. This certification enables access to special loans from the prefecture and other benefits. The company also puts efforts into post-checkup care. Ms. Takayama states that they utilize the results shared by the health checkup providers to review NCD risk factors such as blood pressure and blood glucose.
The data is presented in an easy-to-understand graph showing the national ratio, the Oita Prefecture ratio, and the ratio unique to the construction industry. We use this data to see how different our company is from others. We send this data to everyone in the company by email.
A public health nurse at Hohi Public Health Center comments on their initiatives towards companies.
Once a year, in December or January, we receive a results report on health-related initiatives. We look at the data, share the status, and visit each company together with municipal staff and discuss what the public health center can do to improve the health of their employees, what the city can do, and what should be done in the future.
Companies take the initiative in promoting the health of their employees and work together to improve health. The public health centers also work with municipalities and various organizations to support the efforts of companies. An important part of promoting such community and workplace approaches is data utilization. Takata City boasts top place in Oita Prefecture for gross agricultural production. Despite this, it was difficult to have residents realize that their vegetable intake was inadequate. Ms. Mika Suehiro is a registered dietitian at the Hohi Public Health Center.
Particularly, people in their 30s and 40s are perhaps so busy that they don't have enough time for cooking, and they tend to have inadequate vegetable consumption.
Takata City uses a specific device that measures vegetable intake and shows quantified data to residents. It also collects data for planning healthy diet promotion activities. The city also collates the health status and issues of residents from the National Health Insurance Database and National Database of Health Insurance Claims and Specific Health Checkups, and publishes the State of Takata City in print form annually as part of initiatives to improve health awareness. Ms. Mariko Yoshida is the Chief Public Health Nurse for Takata City.
The national government publishes evidence-based research results and policies, and the role of the public health nurse is to inform them to the community. We cannot implement what we don't know. Our goal is to implement cross-sectional measures to prevent NCDs and achieve health for all, to leave no one behind, from the womb to the tomb.
Hohi Public Health Center's director, Dr. Tonai, comments that the use of data can be expected to not only facilitate the connection between government targets and local policies, but also to provide feedback from the local level to the national level in the form of results and lessons learned.
In the past, when we looked at data, we concentrated on outcome indicators such as treatment costs and the number of new dialysis patients associated with those costs. But if we look properly at process indicators prior to final outcomes, such as data about lifestyle habits, we should be able to identify what is lacking or what would benefit community health promotion. If we can look at environmental and lifestyle indicators at the community level and generate evidence showing improvements, we can present this to the national government. I think the national government would consider using these indicators for the targets of the next phase of Health Japan 21. I think it is necessary to create evidence at the community level and promote a bottom-up approach.
We have seen here that Japan emphasizes health promotion in NCD prevention measures for extending healthy life expectancy of its citizens. In recent years, the proportion of middle and older-aged adults in the working population is also increasing, and keeping employees healthy is becoming increasingly important for companies. Moreover, particularly for the high-risk working population, in addition to initiatives for individual self-motivated health promotion, companies and local governments need to support lifelong health management through health services, such as health education, health consultation, and health checkups. It is necessary for public health professionals to share awareness of NCD prevention measures and collaborate with business sectors based on evidence while checking needs and results. By working together, the community and the workplace can aim for the same goal of a healthier life. The burden of NCDs is increasing, not just in Japan, but globally. In low and middle-income countries where these issues will become more serious in future, JICA will leverage its experience in Japan to support the NCD prevention measures and contribute to the promotion of people's health.